Welcome everyone. Today we are going to cover the lower extremity. We're going to start with the hip and then we'll work our way down. We'll do the hip muscles, then we'll look at, when we look at the hip, we will look at it from the anterior, then we'll look at it from the posterior, we'll look at it from the lateral, we'll look at it from the medial. We'll do the same thing when we look at the knee, we'll look at it from anterior, posterior, we'll look at medial and lateral. When we go to the lower leg, we'll look at the orientation the same way, anterior, posterior, medial, and lateral. So you have to be able to orient yourself with the extremity and know what view you're looking at it, what is superficial, what is deep, what's lateral, what's medial, etc. Okay, so we're going to start with the lower extremity. Let's click on this one first. And we're going to look at a little bit of everything, right? We're going to just skim through what we have here in the front of the hip. We'll look at some of the orientation in front of the thigh, and then we'll look at what we can see from this view from anatomical position in the front and a little bit on the posterior side. So from the anterior view here, we can see some of the main hip flexors. So psoas major and iliacus are two very powerful hip flexors. And if you need a review on what hip flexion looks like, make sure you go to YouTube and go and review my video that was done many years ago on me actually performing many of the actions. And as I perform the actions, I even discuss what main primary muscles do those actions. Okay. So I strongly encourage reviewing that. So here is psoas major. And what's unique clinically about the psoas major is that it originates on the lower lumbar vertebrae and it inserts onto the lesser trochanter. Now, the reason why I say it's an interesting muscle clinically is because not only does the psoas major originate on the lower lumbar vertebrae, but also their discs, the intervertebral discs. So it's a hip flexor or a trunk flexor, which when I think of trunk flexion, I think of sit-ups. And many people do very fast, rapid sit-ups to try and strengthen their abs. And at the same time, they pull the psoas major, and that muscle pulling can actually start to herniate and bulge discs. Now, one thing to remember is that the abdominal muscles are not designed for fast, rapid movement, right? Like the quadriceps here in the thigh, those muscles could be for sprinting or running, right? Fast, explosive movements. The shoulder muscles and the finger muscles, they are fast, explosive movements. But the psoas major is a hip flexor, whereas the abdominal muscles are not designed as the same way as the psoas muscle is. The abdominal muscles, like the rectus abdominis, the obliques, the internal and external oblique, the transverse abdominis, they're stabilizers. They stabilize the trunk. They're postural muscles. They're really not designed for fast, rapid forms of movement. And that's why a lot of people end up coming to me with back pain and disc herniations just simply from poor movement and poor exercise habits. So the psoas major is a hip flexor. So is the iliacus. When you look at the iliacus, that's the muscle that originates on the iliac fossa. But iliacus has the exact same insertion site as psoas major, both being on the lesser trochanter. Okay, remember the trochanters are on the femur, tubercles are on the humerus, greater and lesser tubercle on the humerus, greater and lesser trochanter on the femur. Sometimes the psoas major and iliacus, you could see here, this is the inguinal ligament going from the ASIS to the pubic tubercle. That's called the inguinal ligament. And when these two muscles, the psoas major and iliacus, blend in together and they share that same insertion site on the lesser trochanter, they call the muscle the Ilio Psoas. They call it the Ilio Psoas. It's taking a little bit of this name and a little bit of this name, joining them together, creating the Ilio Psoas as the primary hip flexor. Now, since I mentioned the anterior superior iliac spine, the ASIS, we can see that there's this upside down V right here, okay? And these are two separate muscles that originate on the anterior superior iliac spine. One is the Starbucks muscle, TFL, known as the tensor fascial latae, right? Tensor fascial latae. That originates on the ASIS. And the longest muscle in the body called the Sartorius. You can see that it originates on the ASIS, crosses superficially. It's even more superficial than the rectus femoris, right? And it crosses over to the medial aspect of the knee and inserts right here, which is just medial and posterior, right? It's medial and posterior to the tibial tubercle. Hopefully now you're understanding why these bony landmarks that we did when we covered osteology are so very important, because there's muscles and tendons that originate there or close to it. So here's the patella, the kneecap, here's the tibial tubercle. Medial and posterior to it is an area called the pes anserine. The pes anserine. It actually means goose foot. And there are three tendons that attach on the pes anserine that give it this appearance of a goose foot, like that webbed type of appearance. So we have the TFL, tensor fascial lata, and the Sartorius. The TFL, although it originates on the ASIS, it inserts on this long, broad band or tract that is on the lateral side of the leg. And this tract, it's kind of camouflaged because it looks like it kind of blends in with the background a little bit. But if we hone in and we look carefully, we can see where the TFL ends right around here. There's this long band that comes around the outside of the leg, and outside of the thigh, I should say, and attaches here to the tibia. That band or tract is called the iliotibial band or the iliotibial tract, because it goes from the ilium down to the tibia. So it's called the iliotibial band or the iliotibial tract. So the TFL, the tensor fascial latae, although it originates on the ASIS, it inserts on the iliotibial band. The Sartorius originates on the ASIS and inserts medial to the tibial tubercle on that region called the pes anserine. In terms of actions, when a muscle, you have to look at the orientation of it. So this muscle is a little bit anterior, but it's also lateral. So because it's anterior, it can bring that lower extremity anterior, which is flexion of the hip or hip flexion. But because it inserts on the outer part of the thigh, where the iliotibial tract is, it's an abductor of the thigh. So hip abduction and hip flexion. That's what the TFL does. Whereas the Sartorius, on the other hand, the Sartorius I refer to as the Faber muscle. And you'll want to write this down. Faber, F-A-B-E-R. F-A-B-E-R. Faber, F-A-B-E-R. B as in boy, Faber. And I tell my students the Sartorius should be your favorite muscle, not favorite, but favorite muscle, F-A-B-E-R. And the first few letters tell you the action of the muscle. So F is for flexion, then AB in favor, AB is abduction of the hip, and then ER is for external rotation. So this one muscle flexes, abducts, and externally rotates the hip. And when you do all of those actions simultaneously, it's like crossing your legs, sitting with your legs crossed in a figure 4 position that flexes, abducts, and externally rotates the hip. Again, make sure you watch my video on range of motion to help you give you a little bit more of a visual on that. Okay, now let's look at what we can see here on the anterior thigh. When we talk about hip, we're usually referring to what's up here, hip flexors and hip extensors. Here we typically refer to this sometimes as the anterior thigh muscles, femoral muscles as well. So in the anterior thigh, there are quadricep muscles. Quad means 4. On the posterior side, which we can't see, we have hamstrings, and there's 3. So 4 quads, 3 hamstrings on the posterior side. Let's look at 3 of the 4 quads that we can see. The most superficial one that we can see right down the center is called the rectus femoris. That's the rectus femoris right here. Then there are 3 vastus muscles, but one of them we cannot see from this view because it's being blocked by the rectus femoris. When I say it's being blocked, what I'm implying is that the rectus femoris is superficial to the 3rd vastus muscle that lies deep to this. So the 2 that we can see is the vastus medialis and the vastus lateralis. Now between vastus medialis and vastus lateralis is a vastus intermedius. Intermedius just means it's in between. So it's in between the medialis and lateralis, vastus intermedius. And again, it's deep to the rectus femoris. And if we pull and dissect this away, which we will shortly, you'll be able to see it. All 4 of the quadricep muscles cross the knee joint. They cross over the patella and they insert right there on the tibial tubercle. So since they cross the knee and attach to the leg, it has to move the leg, and it will extend the leg, or leg extension. That's how you would write if it asks for any of these actions, leg extension. One of the four muscles, which is the rectus femoris, doesn't just cross the knee joint, but it also crosses the hip. It crosses the hip because it originates on the AIIS, the anterior inferior iliac spine. So the Sartorius originated on the anterior superior iliac spine. The rectus femoris originates on the anterior inferior iliac spine. Since the rectus femoris crosses the hip joint and it's in the front, it has to move that extremity to the front. And you know that type of movement is called hip flexion. So the rectus femoris can flex the hip and extend the knee. So we would say hip flexion, leg extension, or knee extension. They're interchangeable, however you feel comfortable. Okay, so we did some of the anterior muscles here. I introduced you to a little bit of the lateral concept. I'm going to show you a little bit of what's on the inside here that we can see still from the anterior view. We're going to be taking this extremity and rotating it medially so you get a better view of it, but you can see some of the medial thigh muscles here. And again, Lindner's rule, if the muscle is on the front, it moves the limb to the front. If it's on the outside, it moves the limb to the outside. And if it's on the inside, it moves the limb to the inside. So now you just have to know, well, what is it called when it moves that limb to midline? Well, that's called adduction, adduction. So what we see here on the inside that looks like it's attaching to the pubic bone, like the pectineus, the adductor longus, and gracilis, since these are all medial compartment muscles of the thigh, they adduct the thigh. Again, they adduct the thigh. Now, I said that the sartorius is the longest muscle in the body. Well, who comes in second place? Second place is the gracilis. It originates there on that pubic bone, comes all the way down, and inserts just behind the sartorius. Remember I said the sartorius inserts on that pes and serine? Just posterior to that insertion is the gracilis. So that's the second muscle that makes up the goose foot, or the pes and serine. The third muscle is a hamstring muscle called the semitendinosus, and I'll show you what that looks like when we cover the hamstrings. Okay, let's look down at the anterior leg. So the concept here is similar to the forearm, right? Muscles of the forearm cross the wrist. So if it crosses the forearm, like the, let's say, the flexor carpi ulnaris or palmaris longus or pronator teres, we know that they originated on the medial epicondyle of the humerus. They have to act on the elbow, so they can flex the elbow. Although it's not their primary action, they can do that. But some of those muscles that cross the elbow also cross the wrist. And if they cross the wrist on the anterior, then they have to flex the wrist anteriorly, and that's called wrist flexion. Some of those also cross the fingers, so they can flex the fingers. So we apply that concept to what we see here. These are muscles of the lower leg, where the tibia and fibula lie. They cross the ankle, so they have to act on the ankle. And some of them cross the toes, so they have to act on the toes. So I'm just trying to make a parallel. If you understand the concept of what happens in the upper extremity, similar thing happens in the lower extremity. So the tibialis anterior, right? It's anterior to the tibia. Very, very powerful foot or ankle dorsiflexor. So dorsiflexion is when you're walking on your heels. That's dorsiflexion of the foot, or foot dorsiflexion, or ankle dorsiflexion. The antagonistic action to dorsiflexion is stepping on your tippy toes. And that's plantar flexion. Plantar flexion would be stepping on your tippy toes. So the tibialis anterior is a very powerful dorsiflexor. And because this muscle inserts on the medial aspect of the foot, it does foot inversion. Inversion is when you take your feet and you try and bring the soles of the feet together. That's called inversion. And when you bring the soles of the feet out, that's called eversion. So you have foot or ankle inversion, foot or ankle eversion. Most ankle injuries happen when you slip down the stairs or slip off a curve and the foot rolls in, right? That's called an inversion ankle injury. When the foot inverts, you stretch and tear a lot of the ligaments on the lateral side of the ankle. That's where this part swells up, turns all black and blue, and you have a very, very bad sprain of the soft tissue ligaments on the lateral side where that lateral malleolus is, most commonly called the anterior talofibular ligament. And if you look at the name, anterior talofibular, going from the talus to the fibular bone. anterior talofibular ligament. It's the most common ankle sprain, the most common structure sprained in a plantar flexion inversion injury, which happens when you slip off a curve or your foot goes into a little pothole or you trip and it just rolls in. And I explained when we did osteology why the foot commonly inverts, where it's easier for the foot to invert than it is to evert. And it's due to the relationship between the medial malleolus compared to the lateral malleolus, right? If you look at which one descends further distally, the lateral malleolus goes further down than does the medial malleolus. So it's easier for the foot to invert than evert. So again, tibialis anterior is a foot inverter and a foot or ankle dorsiflexor. Lateral to the tibialis anterior is another important muscle that crosses the ankles, but this one, if you follow the tendons, they go to the toes 2 to 5, and that's called extensor digitorum longus. Anything that's in the front of the leg that crosses the foot and goes to the toes can extend the toes upward. So that's called toe extension, and when the toes curl down, that is toe flexion. Toe extension, toe flexion. From this view, we can see a little bit of some of the posterior muscles. And again, this is the great toe, so it's on the medial side. We could see the large gastrocnemius, and what's deep to it is the soleus. These are plantar flexors, foot or ankle plantar flexors. And since this is on the medial side, this is the medial head of the gastrocnemius. When we rotate the leg around, I'll show you that the gastrocnemius has 2 heads, a medial head and a lateral head. Okay, so that's a little bit of what we see from the front. Okay, let's go back. And now let's look at the same thing. We're now going to rotate it a little bit to the lateral view. Okay, so now let's zoom in, and here is anterior, here's the sacrum, here's posterior, here's the iliac crest, right? So if we look at this whole thing, we see the foot pointing this way, so we're looking at the lateral side of the leg and the lateral side of the thigh and the lateral side of the hip. So here is that TFL, the tensor fasciae latae. Remember I said it originates on the anterior superior iliac spine, but then inserts on this tissue that's called the iliotibial tract or the iliotibial band. It is a major stabilizer of the lateral side of the knee. It's this entire structure. Iliotibial band or iliotibial tract. Now, is that the only muscle that attaches to the ITB? No, there's another muscle right here called the Gluteus Maximus. This muscle is named by its size. So we see Gluteus Maximus here, and then a little bit deep to it, Gluteus Medius. And there's a third called Gluteus Minimus. So there's a Maximus, Medius, and Minimus. But if you look at the Gluteus Maximus, it's a pretty large muscle. It originates on the little bit on the pelvis as well as the sacrum, but the insertion, remember the insertion is the movable part, it inserts also on the iliotibial band. The Gluteus Maximus is the primary hip extensor. The Ilio Psoas was the primary hip flexor. Antagonistically, right, flexors and extensors have to be on opposite sides of the bones. So Ilio Psoas was in the front, psoas major and iliacus, and on the posterior is the Gluteus Maximus. This is your stairmaster muscle. This is the muscle that's being used when you're sitting and you go to a standing position, or when you're climbing stairs, or you're doing squats. That's your Gluteus Maximus. Gluteus Medius, which is deep to it, this is the primary hip abductor. abductor, primary hip abductor. So sometimes if you go to the gym and then you're lying on your side or side lying and you bring your hip up towards the ceiling, that's abducting your thigh. Thigh abduction or hip abduction. So gluteus medius is your primary hip abductor, gluteus maximus is your primary hip extensor, and ilio psoas is your primary hip flexor. Now we're looking at the thigh from the lateral view. So you could still see some of the anterior muscles of the thigh, and now we start to see some of the posterior muscles of the thigh. Since this is on the lateral aspect, we could see one of the quadriceps on the lateral aspect, which is the vastus lateralis. When we were on the medial side, you could see the vastus medialis. We can also see some of the posterior muscles of the thigh. Remember, on the anterior thigh, it's the quadriceps. We said there's 4. On the posterior side of the thigh, there are hamstrings, and there are 3. One of them is the bicep femoris. Bicep means 2. There is a long head and there's a short head. So on the lateral aspect, we can see the bicep femoris, and it's the long head, and it inserts on the head of the fibula or fibular head. That's why the head of the fibula is such an important landmark. The other 2 hamstrings we could see better from the medial view, not so much from the lateral view, but more of the medial view. Okay, let's look at the lateral side of the leg. Now again, anterior in the front, posterior in the back. On the posterior compartment, 2 main ankle or foot plantar flexors. One's the gastrocnemius, the other one that's deeper is the soleus. Both of these combined attach to the calcaneus. That's where the insertion is, on that tarsal bone called the calcaneus. This tendon back here is the infamous Achilles tendon. That's called the Achilles tendon back here. Since we're looking at the foot, here's the pinky. So this is the lateral aspect. The gastrocnemius has a medial head and a lateral head. The head we're looking at here is the lateral head of the gastrocnemius. The other thing that I'll show you when we point to the gastrocnemius and we look at it purely from the posterior part, the gastrocnemius crosses 2 joints. It crosses the knee and it crosses the ankle, which means it has to act on the knee and it has to act on the ankle. Since it's on the posterior side, it can flex the knee and plantar flex the ankle. On the lateral leg, there are 2 muscles, peroneus longus and peroneus brevis. Sometimes it's called fibularis longus and fibularis brevis. They're both interchangeable. Both would be correct. Peroneus longus is more superficial. And then peroneus brevis is lateral and deeper to it. You can see the belly of it here and the belly of it here. But this belly is superficial, and then you can see the tendon going right behind that medial malleolus of peroneus longus. Okay, let's get out of that and let's look at the posterior thigh now. Again, superficially, we're looking at the posterior hip, posterior thigh, posterior leg. Now, let's just look at the posterior leg since that was where we left off. And I said from the posterior side, we could see the gastrocnemius and the soleus. Both of those muscles combined attach to the calcaneus by way of the Achilles tendon. The most common tendon ruptured within the human body happens to be the Achilles tendon. Sometimes from trauma, sometimes not. I've seen numerous patients over the years, young patients, who were sick that were on antibiotics, there are certain antibiotics that can actually damage mitochondria and weaken the musculotendinous junctions, and they can rupture this purely from walking. So you always want to be careful and research any medication, even something as common as an antibiotic, to make sure that there are no tendinopathies associated with that antibiotic. Tendinopathy just means any type of disease or lesion that may be affiliated with tendon damage. So that's the gastrocnemius. You can see it deep to the gastrocnemius. Remember, I said there's two heads to the gastrocnemius, one on the lateral side, one on the medial side. So you have a medial head and a lateral head of the gastrocnemius. And I also said that it's the only one of the two that crosses the knee joint. The soleus does not cross the knee. Since the gastrocnemius crosses the knee and crosses the ankle, it can flex the knee flexion, and ankle plantar flexion. The soleus only does ankle plantar flexion. Let's look at the posterior thigh, where I said we have hamstrings, and there are three of them. We already covered one on the lateral side. That's called the bicep femoris. And again, bicep means two. There's a long head and short head. The superficial head is the long head. Deeper to it is the short head. All of the hamstrings, all of them originate on the ischial tuberosity. That's why the ischial tuberosity was so important when we covered osteology. That's known as the sit bone, the bone that makes contact with the chair. The other two hamstrings are the semi-sisters, the semitendinosus and the semimembranosus. So we have the bicep femoris lateral, and we have the semi-sisters medial, semitendinosus and semimembranosus. The semitendinosus and membranosus, they also originate on the ischial tuberosity. They cross the knee. So what can they do? If they both lateral and medial muscles, if they cross the hip and they cross the knee, well, what's it going to do at the hip? Well, it's on the posterior, so it's going to pull the hip back. That's called hip extension. And since it crosses the knee on the posterior, when it bends the knee back, that's called knee flexion. Okay. And if we look a little bit higher up, now we could see from the posterior view, the gluteus maximus, that primary hip extensor. We can see that it originates a little bit on the pelvis and a little bit of the sacrum, and then it attaches to or inserts on the iliotibial band, also known as the iliotibial tract. You could see some of the inner thigh muscles. The most medial one is the gracilis. Since it's medial, it's an adductor. And then there's a large adductor magnus muscle. Now from this view here, we could see a little bit of the pes anserine. Remember I said the goose foot? So I'm going to show you that when we rotate the knee more medially. Which we'll look at now. Let's look at the medial side of that. So we know we're looking at it medially. You could see the lumbar spine and the sacrum. We could see it cut. Here is the psoas major in the front of the lumbar spine. You could see how it attaches to the discs and the lumbar vertebrae. On the posterior side, we can see a little bit of the gluteus maximus. Now we're looking at the medial thigh, so we can see, here's that goose foot I was telling you about. Here's the tibial tubercle. So posterior to it, we have 1, 2, 3 tendons that attach there. Let's take a look at them. From the front, it's the Sartorius. That's one of the muscles of the pes anserine. Just posterior to it is the gracilis, which is here. And posterior to that is this tendon, which is called the semitendinosus. So we have the sartorius, the gracilis, and the semitendinosus all coming in, making up this goose foot appearance, just posterior, medial, and posterior to the tibial tubercle. Okay. Here's the large adductor magnus. You can't see how large it is from this view because you have all the superficial muscles covering it. But if all these muscles were dissected away, you'd see why it earned the name adductor magnus. In fact, a lot of anatomists, when we look at the adductor magnus, we break it down in terms of actions based very in a similar fashion to the deltoid. Remember the deltoid, we said there's an anterior fibers, middle fibers, and posterior fibers. The adductor magnus could be set up the same way, where there's anterior, middle, and posterior fibers of it. So we can flex the hip, it can extend the hip, it can adduct the hip, can medially rotate. It could do so many different things, much like the deltoid. Okay, since we're looking at the thigh from the medial aspect, that's why we see the vastus medialis. When we looked at it from the lateral aspect, you can see the vastus lateralis. Now we're looking at the medial aspect of the leg, so we see the medial gastrocnemius, and we see the soleus that's deep to it. Here is the Achilles tendon. The gastrocnemius and the soleus both plant or flex the foot, so they are involved with foot or ankle plantar flexion. Okay, let's look at the second row. Let's hone out of that. Now, we're going to go from here, looking at the anterior thigh muscles. We're going to look at the same thing, but here we had the rectus femoris. We're going to pull that away so we could see what's deep to it. So here is the anterior thigh muscles in front of the femur. You can see the vastus lateralis. We see the vastus medialis. But what was cut, we see this tendon right here proximally, and we see this tendon here distally. So something was cut here to here, and that is that most superficial and medial quadricep muscle called the rectus femoris. With the rectus femoris out of the way, you can see the vastus intermedius. Okay, so the vastus intermedius, vastus lateralis, and medialis cross over the patella. They attach to the patella, but then cross over it. It crosses over it, and its final destination is going to be on the tibial tubercle or tibial tuberosity. On the medial compartment, we can see the adductor longus and the pectineus. The adductor longus is the most common muscle involved with groin pulls, like in soccer or in football when the kicker has to try and score that field goal and they kick the ball. That is the adductor longus that's involved with a groin pull. You can see its proximal origin on that pubic bone. Okay, now we're going to go and look at the lateral aspect of the thigh and the hip, lateral aspect. So here you can see the gluteus maximus muscle that's cut. Now that that's cut and peeled back, we could see what's deep to it. What's deep to it is the gluteus medius, which is a primary hip abductor, abductor. And then we see these smaller muscles that are called lateral rotators. They externally rotate the hip or laterally rotate the hip. So they're hip external rotators or hip lateral rotators. Those two terms are interchangeable. One of the major landmarks near the lateral rotators is the sciatic nerve. When you find that sciatic nerve, which is the largest nerve in the body, the muscle just superior to it is called the piriformis. And there's a little typo there. It should be PI, not PY. So piriformis is PIRIFORMIS, piriformis. When the piriformis is in spasm, it can put pressure on the sciatic nerve. When it's in spasm or hypertrophies, it can irritate the sciatic nerve, creating a form of sciatica called piriformis syndrome. And a lot of runners tend to get this, so they do what's called the piriformis stretch. If you want to look that up, you can certainly research it and look, how do I stretch the piriformis muscle? Then we can see that there is a gemellus superior muscle, a gemellus inferior muscle, and between the gemellus superior and gemellus inferior is an obturator internus. And there's also an obturator externus. You just can't see it from this view. The most inferior lateral rotator is called a quadratus femoris. Quad because it has 4 sides. 1, 2, 3, 4. It looks like a rectangle. Quadratus femoris. So all of these here all have the same insertion site. They all attach to the greater trochanter. All of those lateral rotators insert on the greater trochanter. The piriformis is the only one that originates on the sacrum, and it originates on the front or the anterior sacrum. You can see the hamstrings right here. They originate on the ischial tuberosity. Ischial tuberosity. Okay, let's just see if there was anything here that I needed to show you. Okay, here's a superficial view of the posterior hip. There's the gluteus maximus. Remember, when this is peeled back, it will allow us to see the muscles that we just covered, the piriformis, the gemellus superior, gemellus inferior, obturator internus, and the quadratus femoris. The one that you can see is the obturator externus, which is on the other side. You can see a little bit of the gluteus maximus up here. Here are the 3 hamstrings. There's your bicep femoris, and then semitendinosus and membranosus. You can see a little bit of a close-up view, a little bit of the pes anserine here. A little bit of the pes anserine. Okay, this looks like it's probably going to show a little bit of what we've already seen, but we can review it nonetheless. There's the gluteus maximus that's cut. There's the gluteus medius. Here's your piriformis, because there's your sciatic nerve. Just above it is the piriformis. Then we can see the superior gemellus and inferior gemellus. And between those are the obturator internus. The obturator externus is on the opposite side. It can't be seen here. And there's the quadratus femoris. So all of these, the piriformis, both gemellus, the obturator internus, even the obturator externus, which can't be seen, and the quadratus femoris, all of them are hip external rotators. That looks like taking your foot and rotating it laterally, like walking out like a duck. That would actually be hip external rotation. And then there's your sciatic nerve. And you can see the hamstring muscles here. We can see the long head of the bicep, short head of the bicep, and the semisisters, semitendinosus and semimembranosus. Those are the 3 hamstrings. They originate on the ischial tuberosity. They cross the knee. The bicep femoris is the one that inserts on the lateral side. That's the head of the fibula. The semitendinosus inserts on the pes anserine. They flex the hip, right? Hip flexion, knee flexion. I'm sorry, let me say that again. Let me correct myself. I just heard what I said and it was incorrect. Hip extension, but knee flexion. Hip extension, but knee flexion. So if you think of what happens, these become very, very tight on people, especially when you sit. So when you're sitting, your knees are flexed, which means that the hamstring muscles are in a shortened position here, but the proximally, this part here, your knee is in a not just flexed position, but your hip is flexed. So now all of a sudden you want to stretch your hamstrings, you have to extend your leg out, which now puts a strain and stretch by elongating the hamstrings. That's why many, many people can't stand up, bend down and touch their toes. By bending down to touch your toes, you're elongating and stretching the hamstrings. More than 90% of my patients, when they have lower back pain and disc problems, I can't take their leg and stretch it up in the air past 30, 40 degrees at best, and you should be able to get to 90 degrees. So what ends up happening from tight hamstrings, it tugs and pulls on the ischial tuberosity. When it pulls on the ischial tuberosity, it changes the orientation of the pelvic bone, which changes the orientation of the lumbar spine. And that's where this sciatic nerve comes from. It comes from the lower lumbars at L4 and L5. Okay. Okay, let's look at, I think we're on our last row here. So let's look at the lower leg. We'll look at it from the lateral view first. So here's the lower leg. And from the lateral leg, we can see the muscles that are purely lateral, which is the peroneus longus and peroneus brevis, also known as fibularis longus and fibularis brevis. You can see the fibularis longus, the belly's up here. And if we go right down, here's the tendon of it. Kind of outlined it a little bit with that yellow marker here. So here's the tendon of it. And then on both sides of that, that's where you have the peroneus brevis, on this side and on this side. You could see as it comes down, here's the peroneus longus. It goes behind the lateral malleolus, goes underneath the foot, and goes right to the medial aspect of the foot, to that first cuneiform and the first metatarsal. Your peroneus brevis comes down here and attaches to the the base of the fifth metatarsal right there. These are foot everters. Since they're on the lateral side of the leg and crossing the ankle on the lateral aspect, it can evert the foot. From the same view, we can see the orientation of the posterior leg muscles and a little bit of the anterior. So we can see the gastrocnemius, you can see the soleus, that's the Achilles tendon. On the anterior side, this is the extensor digitorum longus that crosses the ankle and goes to tendons, to the toes 2, 3, 4, and 5. So it does foot or ankle dorsiflexion and toe extension. Let's look at the posterior leg, and we're looking at it from the medial aspect. Here's the medial malleolus. Here's the calcaneus. What is dissected away here is the medial gastrocnemius, right? The medial head of the gastrocnemius. Here is the lateral head, but it says here the medial head was removed, which would be here. So you can see the orientation of what lies deep to it, which is the soleus. So you have the gastrocnemius, you have the soleus. Now this tendon here, you can see a little bit of the belly here, right? Here's the delineation. This little line is separating this from this. So the lateral head of the gastroc, this is called the plantaris. This tendon is called the plantaris. It would be analogous to the palmaris longus of the forearm. It's got a very, very long tendon, the plantaris. So the gastrocnemius, the soleus, and the plantaris, they're posterior leg muscles. They all attach to the calcaneus. They all make up the Achilles tendon. They all are involved with ankle plantar flexion. Now what we're going to do is we're going to peel away these three superficial muscles, the gastrocnemius, the soleus, and the plantaris, and we're going to see what's deep to them. Okay, so let's do that. What's deep to those are these muscles. So this is the posterior leg. It looks a little bit different without the gastrocs and the soleus and the plantaris. And we can see that behind the knee, here's the head of the fibula right here. Behind the knee is this oblique muscle called the popliteus. Popliteus is very important. It only crosses the knee joint and it crosses on that oblique diagonal, you can see, but we call it the key that unlocks the knee. We call it the key that unlocks the knee. In order to flex the knee first has to unlock. And to unlock, the tibia medially rotates a little bit. When the tibia medially or internally rotates a little bit, it allows the knee to open up and unlock, and then you can flex it. Okay, so the popliteus is the key that unlocks the knee by medially rotating. These three muscles, now we have right in the middle, right? You have one here, one here, one here. It's like a sandwich. We have the flexor hallucis longus. So it's going to go on the posterior leg. All three of these muscles cross on the medial aspect of the ankle, just posterior to the medial malleolus. So behind the medial malleolus, if we wanted to orient these from anterior to posterior, it would be flexor digitorum longus would be the most anterior as it crosses behind the medial malleolus. I'm sorry, let me change that. The tibialis posterior is the most anterior behind the medial malleolus. Then just behind it would be the flexor digitorum longus. And then just behind it would be the flexor hallucis longus. So the three tendons that are just behind the medial malleolus, behind it posteriorly, but from anterior to posterior would be the tibialis posterior, then the flexor digitorum longus, and the most posterior is the flexor hallucis longus. And a little mnemonic to remember that, I like to say Tom, Dick, and Harry. Tom, Dick, and Harry, the expression. So Tom would be the T here, tibialis posterior. Tom, Dick would be the D in digitorum, so flexor digitorum longus. And Harry, the A and the N stand for the tibial artery, tibial nerve. Tom, Dick, Ann, right? Tibial artery, tibial nerve, and then Harry for hallucis, flexor hallucis longus. Okay, so you should be a little bit familiar with those. The one that's in the middle, right? If you look at the belly of the muscle, The tibialis posterior is the one that's kind of centered. The one that's the most lateral is the flexor hallucis longus. And that's kind of unique because the belly of the muscle is lateral. But as you can see underneath the foot, the tendon goes medial. So when you have a belly of a muscle that's lateral, but the insertion is medial, the angle of pull is on this oblique. And it's one of the muscles that's involved in pulling the great toe laterally and involved in causing bunions. It causes a bunion because it's pulling the great toe laterally in the same direction as the belly originates, right? It's on this oblique angle. So when you have the pull starting here and the insertion is here, you can understand why the great toe is going to deviate. Okay, so that is a good review of the lower extremity. I'm going to stop the recording here and just see if anyone has any questions. Give me 1 second to stop the recording.